The Ontario government made many announcements this week. Booster shots, long-term care this morning, testing, you name it. Lots to sift through. Let's turn to infectious disease specialist Dr. Zain Chagla. Good morning. Thanks for joining us. Good to see you.
Good to see you.
Okay, so we were just talking before the break with the numbers yesterday, 2,421 new cases, breaking that down, over 1,500 in vaccinated. And we realize that we're like 88% vaccinated in Ontario, so that's the huge population percentage. That's still a lot of breakthrough cases.
Yeah, and this is the Omicron piece, right? You
Yeah.
know, the vaccines will protect people from ending up in a hospital, don't get me wrong, but there is going to be more COVID cases amongst vaccinated individuals, given that there is some immune escape to this variant. And so, you know, this is where the numbers can get really high really quickly. Again, you know, getting a vaccine is still important. Even getting a first dose and a second dose is important, as the risk of hospitalization in places like South Africa are 70 to 80% lowered by having a vaccine in your system. But there will be breakthrough cases in this population, and I think we're going to see numbers that are higher than we've ever seen before.
Yeah, with the Omicron cases, so the R value is just through the roof. It's unprecedented. So we know it's bad. And the science table is saying the extreme case modeling, we could see 10,000 cases a day by Christmas. And the fourth wave, this wave will be the worst. But it's hard. With our vaccination rate where it's at, how does it become the worst wave of the pandemic so far? How is it not blunted or muted by vaccination?
Yeah, I mean, first and foremost, if this was March of 2020 and Omicron was here, we would be devastated, right? And you know, I think we have to take that front and center, that this is going to be much better because we have vaccines in many people's systems, and a booster dose will help with some of our even more vulnerable populations. But again, the sheer number of cases, you know, if there is a small percentage of those vaccinated cases that are breakthrough cases that need hospitalization, again, primarily those who are older and with major medical conditions, plus all the unvaccinated people who will be getting COVID for the first time probably in the next 2 to 3 months, you know, all of that can consolidate to have large numbers in a very short span, which is why I think there is alarm here as compared to other phases in the pandemic. This is just escalating so quickly. The vast majority of people who are vaccinated will do fine. But again, you know, just the sheer numbers may take us to a point where we get healthcare overload.
Right. So the vaccinations, as you say, so important, but also isn't testing, and testing is being ramped up this week, but is it enough? Isn't testing as important as vaccines?
Yeah, except the concern is as we get to more people testing and testing positive, as we get to more contacts of people testing, you know, the testing system isn't going to be able to compensate, right? Right now, the wait for a test, even in places like Hamilton, is 2 to 3 days. And so when we get to 4 or 5 days for a test, when we get to 2 days for a turnaround from that test, as the numbers get higher and higher, you know, getting a result 7 days after you develop symptoms is going to mean there's 1 or 2 generations of transmission after you, especially if those symptoms are minor and you continue to go out. So, you know, again, we may see things like rapid tests. We may see things like self-directed testing rather than assessment centers. But we have to prioritize people. And again, those who are at the highest risk are likely the ones that need to be tested up front. And others may be just given advice, like in the first wave, to stay home if you're feeling unwell.
So what do with all the announcements this week, what's being done right? What's being done wrong? How do we get this behind us? Well, I mean, it's going to be endemic, no doubt. But how do we get it in the background so it's the new flu and not this crisis?
Yeah, I mean, number one, boosters are probably the biggest thing here, and especially in those people over the age of 50 who are probably the most vulnerable from those breakthrough cases. You know, those are going to be, you know, essential, and lowering the age limit as well as lowering the date to 3 months is probably the biggest step here. And for those of you who can access them, go access them. But I think, again, what we need to start talking about is how do we prioritize? And again, putting those people front and center who are the highest risk, healthcare workers who, again, carry a vulnerable sector on their shoulders, and how do we support the system so that we don't get people being put into isolation that are, you know, essential for food, for health,
Right.
for safety. And again, those things need to be put out front and center. We're going to Christmas, and we know things slow down at that point. we don't want to be dealing with staffing challenges after Christmas as again, there's going to be consequences for COVID and non-COVID in that sense.
Yeah. Now let's talk about the therapeutics piece in this. And are there hopeful antivirals on the way that can battle this?
Yeah, so we have 2 antivirals, molnupiravir and Paxlovid, which are coming. We have our monoclonal antibodies, which we've been giving in Hamilton and are still accessible for anyone who tests positive who is at risk. And so, they're going to be helpful. And again, the whole point of this, the numbers are going to get large. But if we can find the right people and administer therapy to reduce the risk of ending up in hospital, again, it'll blunt a lot of that healthcare demand that is generated from COVID. We may not be able to stop everyone from getting COVID, but we can certainly keep our hospitals and healthcare afloat, let surgeries continue, let healthcare workers not get burnt out. But we need access, and hopefully, again, Health Canada can approve them sooner rather than later.
Yeah, that's the key thing, the hospitalizations, and so it's not dangerous. It's going to be around, but we have to get that out of the picture.
Absolutely, and there's hope, and these are going to help us for sure. We just need to get access to them, and we need people to get tested, which is the big parts of this.
Yeah, so really quickly, short term, everybody, just to mitigate this, what do we have to do besides get the vaccinated, booster shots, and?
Yeah, wear your mask, get a good quality mask, keep your numbers low in your social gatherings, be very cognizant of your symptoms and don't be afraid to get tested. And as we go into the holiday season, especially as we want to gather, be flexible with your plans. If you're not feeling well, it's not the time to have a gathering until you have a negative test.
Okay, thanks as always for your help. Infectious disease specialist, Dr. Zain Chagla. Have a great weekend.